People Incorporated is a very wonderful organization. They treat people with mental illness with respect, but the thing that I notice the most is that they treat us with compassion.
I really feel that if People Incorporated wasn't available, if I'm not able to go to that crisis unit, I don't think I would be where I am today.
That would be that much less love in my life, that much less care and opportunity in my life.
I would still be bouncing in and out of the hospital, spending tax dollars.
I'd be dead today, and that's a fact.
I think my daughter would be in prison. We wouldn't have good housing. We wouldn't have a safe program for her. I can't even imagine.
Well, I was very fortunate to arrive at Dayton Avenue Church in 1962. It was also known as the Dale Selby community, and there was the highest index of crimes that took place, and broken homes and families, and the people that became part of People Incorporated in the early stages lived directly behind the church in a rooming house. Men who had come out of the service and who had different mental, social problems, and they were given medication, and they were therapeutically addicted at that point, and they would have their breakfast early in the morning, and then they were sent out on the street, or they didn't have anything to do. So we opened the door of the church, and then opening that, the men start coming in. We had the free cookies and coffee, and we got ashtrays there for them to smoke, which is against my principles, but we said that's an enticement of how do you minister, and that's what where it started, basically. 4 churches came forward and joined Dayton Avenue. Harry Schweitzer from the Central Presbyterian Church, David Lange, who was pastor of Church of the Way, George Nierman, who was pastor of the North Como Church in Roseville, and Don Bump, who was pastor of Miriam Lexington.
The beginning of the corporation was a lot of people who had some interests really coming out of a church, out of a faith environment, and they took that as a mission to the community in terms of supporting people who were facing a variety of crises, from chemical dependency to mental health to developmental disabilities.
Bit by bit, we were getting educated. And who was doing the educating? It was the people that were outside, the people who were crying for help and hope.
When we were designing mental health programs, we had clients sitting in on program development as well as staff. We had people from the county and many times from the state agencies. We had professionals, psychiatrists, social workers. And so the corporation was able to draw upon some very good resources in the community, professional, but also client-based, to put the program together. And I think that's one of the keys.
Over the past 40 years, People Incorporated Mental Health Services has grown to over 40 programs around the Twin Cities, including crisis residences, programs for the homeless, drop-in centers, and small residential homes. At People Incorporated, the focus is always on seeing each person's potential, giving them opportunity and guidance so they can achieve their goals and live meaningful lives.
The client-focused approach is key to all of our services. We tend not to focus on the program, but on the client. So we do say we have programs, but those are really secondary. We try to meet the client where he or she is, find out what they want, what they need, what their vision of themselves is for the future. If they don't have a vision, help them develop a vision, bring it to life, and then move toward it. And that's our total goal.
Rick volunteers with People Incorporated's Project Recovery, a program that helps people with mental illness who are homeless and addicted to drugs and alcohol. Rick knows the challenges they face because he's been there himself.
Started doing alcohol when I was 9, drugs when I was 13, and started doing a lot of heavy narcotics by the time before I was even 18. I quit drinking about 11 years ago, but I traded one addiction for another addiction, and my drug use just exploded.
After being arrested in 2004, Rick started to turn his life around. He quit doing drugs, but was still living on the streets with untreated mental illness. Then he met an outreach worker from People Incorporated, who helped him get a place at their Safe Haven in Minneapolis, a program that helps homeless people with mental illness get off the street and get medical care. After 13 months there, People Incorporated helped him move into his own apartment.
I'm very grateful for People Incorporated for helping me get set up in my own place. Currently I'm giving back. Me and another gentleman, we repair laptops, and we turn around and donate them to the Safe Haven or to the outreach workers. And I thought it was about time to start turning my life around and do a little community payback.
Gail has suffered from depression and the stigma of mental illness all her life. After a series of hospitalizations, she was referred to People Incorporated's Nancy Page Crisis Residence, which offers people in crisis a safe, home-like place to recover without the stigma and locked wards that often go along with hospitalization. At Nancy Page, Gail found personalized medical care and a community of people who strengthened her self-confidence. Now she lives independently, but knows that People Incorporated's crisis residence is always there if she needs it.
As a young child, I was aware of the stigma of mental illness from my parents, my father especially. He used the word crazy a lot to describe people that he did not like. Through the media, too, the movies that I had seen, how they depicted the mentally ill, how they treated the mentally ill, how I was treated when my coworkers found out that I dealt with depression. They were not too nice. They would walk by my cubicle, and under their breath, they would mumble things like schizo, or crazy, you know, whatever they said. It was very hurtful, very painful. And I finally had a breakdown where I couldn't deal with anything and landed in the hospital for the first time when I was 29. My first visit with Nancy Page, first of all, I was struck by the house itself. The dining room, the fireplaces, the furniture, markedly different from a hospital situation. Very comfortable, very humanizing. You could almost feel like you're at home. But the care was special. The people there were very respectful and compassionate. And it's very different from a hospital setting where everything is clinical and detached.
Gail also participates in People Incorporated's Artability Art Show, held every October to highlight the talents and contributions of people with mental illness. Gail's artistic talents have flourished since becoming involved with the program, and she's won several Artability Awards for her artwork and writing. Over 90 artists from around the metro area participate in the Artability Art Show each year.
Oh, Artability definitely raised my self-esteem. It made me feel good. It made me feel validated as an artist. It made me feel validated as a person. It made me feel good that I was showing with peers and that the focus was on what you can do, not what you can't.
People Incorporated tries to help people move toward the optimum level of functioning given their limitation in very specific and individualized ways. We find out what their needs are, what they really want, and we go for it.
People Incorporated has been patient in segmenting pieces of, if you want to call it that, a market of mentally ill people and working out ways to get something positive done. You can make an easy case for People Incorporated to be seen as a good alternative investment to not doing anything at all. The use of emergency facilities in hospitals, the cost of putting people in jail, the cost of putting people in prison.
One of the things that I'm especially proud of is that our programs are cost effective, that we save the taxpayers money. For instance, our crisis services. People stay from 3 to 5 days in one of our 3 crisis residences. They stay at a cost of $262 a day, plus a little bit for room and board. A night in the hospital is 10 times that much. So in 3 to 5 days, we're saving 90% of what taxpayers had to pay in the past.
People Incorporated's Safe Haven program, which helps homeless people with mental illness get off the streets and into supportive housing, is much more cost-effective than leaving people with mental illness on the streets and gives them a better chance to live a normal life again.
The reason I think that this program is so important is that it is a much more efficient way of helping people who have been homeless for a long period of time to transition through our programs to get into permanent housing and then to ultimately transition to community care and into a better life involving often educational training and employment.
The thing that I work tirelessly for at People Incorporated is our major mission, and that is we serve a huge niche in the mental illness spectrum of services, and that is we serve the hard to serve.
Well, there aren't many places where people with serious and persistent mental illness can get the kind of services that People Incorporated provides.
The programs just keep getting better and better and better for the clients as we get more resources.
When I came to People Incorporated 13 and a half years ago, we had 40 donors. Now we have 1,000 donors.
People Incorporated has become sophisticated in a way which is unbelievable, with great staff and people working together.
It's the people that keep People Incorporated going. It's the people that make it so folks with mental illness can have meaningful lives in the community.
My hope is that People Incorporated will keep expanding to meet the needs of people and to say that we can do it, and they've done it.